Live from Studio 5 in New York City, this is the News at 6.
All right, it's Monday. Hi, everybody. I'm Ernie Anastas. Thank you very much for joining us, and a Happy New Year to you, too. We have another great show for you tonight. We're going to check the top stories for you in just a minute. But first, let's get started with a very interesting growing medical trend. I'm talking about people traveling to other countries to have surgery. Now, whether it's elective or experimental, many are choosing to travel abroad where some procedures are allowed or just a little cheaper. So is this right for you? We have a live guest coming in right now, but first, Jen Lammers gives us a closer look.
For millions of Americans, it's an excruciating choice to make. Send your kid to college or get that surgery you've been putting off for years. But what if you had a third option, one that could save you tens of thousands of dollars on your medical bill?
The price of American healthcare has been increasing nonstop since at least the 1980s, especially prices at hospitals, inpatient, outpatient services, the cost of drugs. It's all getting really too much for people's wallets.
Especially for those who don't have adequate health insurance. According to the CDC, every year, 750,000 Americans go overseas for surgery. Yevgeny Feyman is the medical progress director at the Manhattan Institute.
A colonoscopy, for instance, a really basic procedure in New York costs $8,500. You go to Switzerland, it's $655.
A huge difference even when you factor in airfare. Medical tourism has been around for years, but back then there was a stigma attached of patients walking into darkened doctors' offices in Thailand and coming back with major complications.
As things have advanced over the past 10 years, things have become much more mainstream. You can search your surgeon. Are they American board certified? Are they local board certified? Is the hospital Joint Commission international certified or not?
The nonprofit Medical Tourism Association works with healthcare providers to connect patients with first-rate clinics overseas. And as healthcare technology has evolved, places like Europe, Indonesia, and Costa Rica have become popular destinations for patients who are looking to recoup on the beach. But Dr. Scott Bloom says there's a big issue most of those patients overlook going in.
Complications happen to every surgeon. It's not a negative to a surgeon in another country, but if you happen to be the recipient of malpractice, what is your legal recourse? And I think for most countries it's going to be slim to none.
But you don't even have to go across the world to get a less expensive procedure. Sometimes all you have to do is go to a different state. And now there are services that let patients shop online for more affordable health care. Websites like MediBid let patients create a profile, request a procedure, and providers bid on the service.
I think between states, we're going to see some pressures start happening, particularly as you have telehealth, you have electronic health records that allow people to be kind of more portable patients. So you're no longer tied to your county when you're going to a hospital.
But whether it's across state lines or across the globe, the advice among doctors, do your research, because medical tourism is not just a day at the beach.
Jen, it's an interesting story. I mean, there's a lot that you told us about, but now post-op care you mentioned is also very important here.
And that's something that Dr. Scott Bloom had mentioned too. That's what a lot of people don't seem to think about, what happens after the surgery. Obviously, with the same team of surgeons taking care of you from start to finish, they know your body and everybody's unique. So you want to be in safe hands. That continuity of care is something a lot of people don't think about.
It's very important. Okay, we're going to talk about it more. Got a special guest joining us right now.
Hello.
Dr. Doris Day is right here. So good to see you, and Happy New Year to you, by the way. First time I see you this first of the year. How are you?
I'm great.
All
Happy to be here.
Yeah, well, it's nice to have you. You're like our regular, and it's always nice to see you and talk about things like this. This is an interesting story, as we just pointed out. As a doctor, as a professional, what is your view on having surgery overseas, abroad?
The most important thing is patient safety. We want patients to have the best outcome and to be safe in the process. I do think, you may be surprised, but I do think that there are some places where you can have a great procedure done really well overseas at a lesser cost. But you have to be very careful, because if you're only price shopping and you don't do your homework, you can end up not knowing who the doctor is, having infections, having long-term scars, having permanent damage, disfigurement, deformity, and problems, and no recourse.
You really have to watch that. Now, we were talking before, and you had mentioned there is an organization, jointcommission.org, and also World Hospital Search. search.org. These are two very important sites to go to.
Right, because there are places around the world that have partnerships with either American hospitals or who go through the process of being accredited by joint commissions that are recognized here. So there are good ways to do this. Now, there are also middlemen who can help make those connections, but you have to be careful because the more middlemen you add in, the more you add to cost, and there's always an incentive for someone along the way, so you may not know what you're getting.
And it kind of does come down to cost every time, right? So you talked about doing your homework as well. Have you heard stories? I mean, you know, there are some positive stories, but also some nightmares that I think you want to share with us.
Oh, absolutely. I've had patients who've come back after having procedures done in other countries, in South America and some other places. They have had severe infections. They've had dehiscence of wound, meaning that their scars have actually opened, and they're really left with major problems that they're now spending more money trying to fix here, and some pretty serious infections. And this is not a rare thing. It does happen. You have to be careful. And these were people who had access to places here, but who chose to go to some other places. And the other thing you have to be careful about, if you're going for a cosmetic procedure, what gets approved here goes through a very rigorous FDA process. Now, I can't say I always love this process. Sometimes I think it takes too long and I wonder why. But there are products that are used in other countries that are not approved here, that will never be approved here. And you can have such serious problems. I see those problems of people who go and they get things injected in their lips or their face. It looks fine at the time. And then 3 to 6 months later, you end up with swelling, infections, granulomas. It's horrible. And you can't get rid of it.
No, you can't. But there's also an exchange program. You were mentioning that there are doctors like yourself are being invited to other countries to perform these procedures.
That's right. So there's doctors that are being recruited from here to go to places like China to perform procedures there. But, you know, so it does go in both directions. There are people in other countries who want American doctors or the best of the best to come and do procedures for them, and they don't want to travel here necessarily, or they bring groups of tourists from China and other countries here to have procedures done. So it does go in all directions.
A lot going on out there, Best advice then, do your homework. We mentioned jointcommission.org and worldhospitalsearch.org.
And never cut corners when it comes to your health.
Okay, Dr. Doris Day, so good to have you here.
Great to be here.
And good surgery, good health to everybody.
Thanks, and I love your show.
Thank you so much, Doris. See you again. All right, there's a lot more coming up for you tonight. You have heard the saying, what old is new again? Well, coming up next, we're going to show you how one visionary's idea for the future was actually tried in New York 200 years ago. Matt King is live with that for us. And be here tomorrow when we discuss job hopping, how it's gone from a negative to something that might help you really get ahead. 2 special guests will join me live tomorrow, right here on the news at 6, and we will be right back.
No need to ask, he's a smooth